Hi, my name's Haley. I'm going to perform a musculoskeletal and neuro exam. This is my patient. Before I would approach my patient, I would provide privacy and also wash my hands before I touch your patient. So Spencer, I'm just going to do a musculoskeletal and a neural function test. I'm just going to ask you to do a couple simple things like move your arms and everything like that. I might be in your personal space just a little bit. If it gets too uncomfortable, just let me know. Okay. So the first thing I'm going to do is inspect her arms, and I'm just going to look for any physical deformities, her skin tone, any hair abnormalities, evenness throughout the whole arm with symmetry and everything. They look good. Next I'm going to check your pulses. So what I'm going to do is just feel. Perfect. I'm going to feel this one at the same time if that's okay. Great. I'm going to go up here as well. Perfect, and both of those are equal bilaterally and strong. And then next I'm going to go ahead and have you do range of motion. So it's just chest to make sure that you can move your arms freely without pain. So I'm going to have you raise your arms up above your head, all the way up, perfect, and then all the way back, perfect, and then out, perfect, and then can you do behind your head, and then chicken wing. Perfect, and so each time, smooth movements, no pain, no signs of pain. Next, I'm going to have you do your arms, so just pull your arms up, great, and then go out, and then in as well. Perfect. Same thing with there, and then your arms, can you make fists for me? And then put them out, up, down, and then flex your fingers out, and in, and make a fist. Awesome, same with that, no jerky movements, always smooth, she showed no pain while doing that. So next I'm going to move on to her lower extremities at this point. Once again, I do the same, inspect for symmetry, evenness, skin tone, no edema, and yeah. So her legs are covered. In a normal patient, I would have them raise up their hands, legs so that I could observe more. And next I'm just going to go ahead and palpitate her pulses. So I'm just going to feel for your pulses on your feet, knees. So I'll do both of those. Perfect. Come back here. Great. And then I'm going to back here behind your knee. Awesome. And each one of those are bilaterally equal and strong. Good, breathe them. Next, I'm going to go ahead and do the range of motion in her lower extremities as well. My patient is in a skirt right now, so I'm not going to have her do her hips range of motion. However, if I had a normal patient, I would have them lay down on their bed with their feet extended and then raise them extended two in the air in a 90-degree fashion, and then bend and flex one knee and move inward and outward 45 degrees, and same with the other to check the full range of motion of the hips. I'm going to have you stand up though, and I'm going to check your knees. So if you stand up and just squat for just a little bit. Great. Can you go a little bit? Perfect. Awesome. Thank you. And you're good. So then her knees had full range of motion, and she was able to move. Can you extend your legs out? Perfect. And flex your toes. Perfect. Point them towards your nose. And then your soles in and out. Towards me and then towards the other. Perfect. Great. And so perfect range of motion in her heels and ankles. No signs of weakness, smooth movements. Next, I could do the Babinski test. I would have my patient remove their shoes, and I would go upward on the lateral side of their foot to the ball in an inward motion and watch their toes fan out. So that would be positive for the Babinski. Next, I'm going to do a test called the rapid movement test. So I'm going to have you place your hands on your knees and go, and then on the outside. Perfect, and do that. And then faster. Perfect, good job. So on that, I was making sure that it was both a smooth movement and she was able to keep pace with both hands at the same time, and she did. Next, I'm going to have you hold your hands out and close your eyes, and then take your pointer finger and point to your nose with your eyes closed. Perfect. And then do the other one as well. Awesome. Great. Good job. So on that, she was able to move her finger to her nose, find her nose, and it be in a smooth movement. So next, I'm going to have you just put your legs out and then go from your heel up on your top of your knee and your shin down to your ankle with your foot. I'm sorry, that was a bad explanation. Yeah. So put your foot, great, and then on the other one as well. Perfect. So she had great range of motion. She was able to follow that. Next, I'm going to have you stick your hand out for me, and then I'm going to have you close your eyes, and I'm going to move your finger just slightly up or down, and you tell me which direction, okay?
Up, down, up, down.
Perfect. And so she was able to know which side it was going. Next, I'm going to have her stand up, and we're going to perform a test. I'm going to have you close your eyes and stick your hands out again. Great. Perfect. And you can close your eyes, or open your eyes, excuse me. With this, she was able to hold position. She did not sway. She was standing in the same position. Next, I'm going to perform the sensation test. So I have a Q-tip. I have one side that is pointy and one side that is soft, and I'm going to go ahead and go from her face, hands, legs, and feet, and do each one to see if she can test the sharp or the soft point. So just tell me if you feel soft or hard.
Hard, soft, soft, soft.
Perfect. And I'm going to do your arms.
Soft, hard, 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 hard.
Awesome. And then on her legs as well.
Hard, soft, 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 hard.
Perfect. And your feet, I'm doing a little bit.
Soft, hard, hard, hard.
Perfect. And so on each of those, she was able to tell me if it was soft or hard. And then next, I'm going to do the deep tendon reflex. I do not have the radial hammer, or the reflex hammer, excuse me. With this, I would, if I had one, I could be able to test her brachioradialis, patellar, and Achilles. What I would do is hold her hand out, and I would hit on her radial side, and her thumb should flex. On the patellar, I would hit the decrease below her knee while her foot was dangling, and her reflex should have her foot kick out. And on the Achilles, I could have her foot dangling as well, or I could have her lay down and have her leg propped up. At that point, I would strike the Achilles, and her foot should jerk as well. So that's the end of my session. Do you have any questions?
No.
Awesome. Thank you so much.